We are here about to report about Wuchereria bronchofti and Brugia malayi. So what is Wuchereria bronchofti and Brugia malayi? These are both mosquito-borne parasites, so both have two important morphologic forms, the adult worm and the larvae, called microphyllae. The adult male is usually the size of a female worm. Here are the important properties of the both nematodes. Adults are thread-like and creamy white. Microphyllae have a transparent sheet. Transmission via mosquito bite, and infected larvae migrate to lymphatics and tissue. So these two nematodes are usually attacks the lymphatic systems of the humans. The life cycle of Brugia malayi and Wuchereria bronchofti. So the mosquito that carries the larvae will bite the human, and in the human stage, the larvae will turn adults into the lymphatic system. Then the adults will produce a sheeted microphyllae that migrate into the lymph. Then those sheeted microphyllae will be in the bloodstream. Then if another mosquito will take a bite into the human, the sheeted microphyllae will be in the midgut of the mosquito. Then it will migrate into thoracic muscles of the mosquito. Then it will turn into a larvae. And after that, it will transform into a bigger larvae. Then it will migrate into the head and the mosquito's probiosis. So again, it will go back to the same cycle. The epidemiology of Wuchereria bronchofti and Brugia malayi. So majority of filarial worm infection worldwide are caused by Wuchereria bronchofti. So Wuchereria bronchofti is worldwide, while the Brugia malayi is only in Asia. So the mosquito vectors for Wuchereria bronchofti is Colex species, Anopheles species, Aedes species, and Masonia species. So while on the other hand, the Brugia malayi there are only two, so Masonia and Aedes mosquito. So in rural areas in the Philippines, major vectors is Anopheles minimus falvirostris. So here in the Philippines, the most common is Brugia malayi. Here is the pathogenesis. So adult worms block lymphatic system, causes edema, pyreviosis, and immune reaction. So microphyllae cause less severe pathology.
Now I'm going to tackle about the diseases. Symptoms of filariasis may vary depending on the species. The clinical course may be divided into the three stages: asymptomatic, acute, and chronic. To better understand each stages, I'm going to summarize each stages. First is the asymptomatic stage, or no symptoms yet. Even though the person has the worms in their blood and the lymphatic system, they don't feel sick yet. Adult worms live quietly in the body, and the blood may have thousands of baby worms called microfilariae. The person can still spread the disease to others through mosquito bites. Next stage is acute stage, or sudden illness. The body starts reacting to the worms. This stage includes having a fever, pain and swelling in the lymph nodes, and in men, the genital area may swell and hurt. In women, the breast may be affected. Also, arms and legs may become painful and swollen. And also, calabar swelling, or soft, temporary swelling under the skin. And also, this stage is also called adenolymphangiosis, which means inflamed lymph nodes and vessels. The last stage is the chronic stage, or long-term problems. This stage happens after the years of repeated infection and inflammation. The body's lymphatic system gets blocked, causing fluid buildup and swelling. And there are different worms cause different problems. First is the Bancroftian filariasis, caused by the Wuchereria bancrofti. It is a severe swelling of legs and scrotum, and also a hydrocele, or fluid buildup in the scrotum. And the skin may become thick and hard. And also, the Malayan filariasis. It is caused by the Brugia malayi. It is usually milder. Swelling happens mostly in the lower legs, arms, and lymph nodes, or the groin and armpits. and the scrotum is rarely affected. Next, we're going to proceed for the treatments. First, the medication. The diethyl carbamazine, or DEC, and ivermectin. These can both target the microfilariae, combined with albendazole for enhanced efficacy. Higher doses may be required to kill the adult worms. Next is a surgical intervention. A microsurgery may be needed to remove adult worms obstructing lymphatics. And for the last treatment, the supportive care. Anti-inflammatory drugs to manage inflammation. Elastic bandages and limb elevation to reduce swelling and improve lymph drainage.